Good afternoon, everyone, and welcome to the webinar. I am Sandra Whitehead. I am the president of SOPHIA currently. And if you're not familiar with SOPHIA, we are a group who creates resources and provides community for HIA and health and all policies practitioners. And that encompasses a wide variety of practice across several fields. So if you're not a public health person, not a planner, that's okay. If you do fall into one of those categories, those are the majority of our members. But we're so happy that you're here. And if you enjoy this webinar and want to get more content from us, please feel free to join SOPHIA. We'll have that link put into the chat for you, but it's hiasociety.org. Today, we are super excited to have John Vick join us from the Tennessee Department of Health. John and I have known each other for, gosh, almost 20 years now, huh, John? When I started at the state of Florida to start their built environment program, John started at the state of Tennessee shortly thereafter, and we were in an ASTO cohort together. And he has been continuously building up this work in Tennessee. He has this great network of people who work all across his state and their regions on health and all policies and built environment initiatives. And so we're very excited to have John with us today. He's going to talk about some of the tools that they use in Tennessee and give you an opportunity not just to learn about those tools, but to think about them in a different way. So it's my pleasure to welcome John Vick.
All right, thanks so much, Sandra. I really appreciate that warm introduction, and always excited to do something with SOPHIA. I've been involved with SOPHIA for a number of years. I'm a SOPHIA member, and just really appreciate all of the great presentations and webinars and work that SOPHIA does. It really impacts our work in Tennessee, and I know that it has a broad reach. So thanks for all that you do through SOPHIA. All right, I'm going to share my screen, and we're going to go ahead and get started. So thanks everyone so much for joining today. I'm really excited to present to you as a follow-up to a presentation that I did. Gosh, I don't know. It's been a couple of months, I think. And so there's going to be a little bit of a repeat with that presentation as I talk about our Built Environment Grant Program and the evaluation approach that we developed for that program. But I've really adapted it for today as a more interactive workshop where I can talk a little bit about the program and our approach, and also the tool that we developed to help our grantees. But we've discovered over the years that this tool has been useful for people beyond Tennessee and the Department of Health and our grant program. And so I'm hoping that this is something that may be of use to your work wherever you are. Excited to share it out, let you play with it a little bit during the meeting today and get some feedback at the end. But a little bit about myself before I jump into this. I actually have been in public health now for about 12 years. I've worked at the local level in Nashville as an epidemiologist. I've been at the state now for about 8 years. I started off in my office as the evaluation and assessment director. And so part of my role was to figure out how we evaluate all of the work that we do. And that includes the built environment work and our grant program. Now I'm fortunate to serve as the director of the office. We still have an incredible office of people who are working on thinking about evaluation and growing our grant program. Shannon Velasquez, who actually is here today and is very involved with SOPHIA, is our built environment coordinator in our office and has really done a brilliant job of growing our built environment grant program over time and continuing to improve it. So if you have questions about the grant program, Shannon is a great person for you to reach out to as well. So I recognize fully that it is, depending on your time zone, it's somewhere right around lunchtime or a little bit after lunch. So it is peak siesta time. And I know this is the time when everybody starts to kind of glaze over and relax and gets a little bit tired. So I'm going to take that as a challenge. I'm going to do my best to keep you engaged, keep this interesting. Part of our meeting today is going to be interactive. So hopefully that'll keep everybody awake and excited and and keep everybody's brains turned on for a little bit longer this afternoon. So, a little bit about the office that I oversee at the Department of Health. The Office of Primary Prevention is a small office that really serves as an innovation office around social determinants of health, and really takes a health and all policies approach to the work that it does. So, very much in line with the mission of SOPHIA. We do work around community engagement at the local level, through our office around primary prevention, social determinants, and built environment work. We are probably one of the departments of health in the country who has been doing built environment and health work the longest. The only ones I know of who've been doing it longer are California, and we learned a lot from them when we launched our built environment and health work. We have our grant program, our coordinators at the local level, as Sandra mentioned, and lots of other projects that we work on focused on promoting healthy communities and healthy places in Tennessee, both in urban and rural areas. We do a lot of work around workforce and professional development for our staff to help them better understand how to do policy systems and environmental change work and primary prevention as an approach to their work in the health department. Cross-sector collaboration, we lead and participate in a number of different interagency collaboratives at the state level, focused on things like food security, housing, and livability. And then we also are the home for coordination around food and nutrition security for the department, focusing a lot on statewide coordination, and better connecting departments that work on different aspects of food and nutrition security in the state. So we do a lot of different kinds of things. One of the things, well, before I get into the specifics of the Built Environment Grant Program, here's today's run of show. So this is what we're going to do today. I'm going to provide an overview, which I'm doing now, of our built environment evaluation approach at the Tennessee Department of Health. We're going to break out into some groups to design built environment project evaluation plans. So this will be the interactive portion. So I'll kind of talk a little bit about what we do, share a couple of resources that you can use in your groups, and then everybody's going to do a really kind of quick, rapid built environment evaluation in their group, and then share those back with our group so we can learn and discuss it. And then we'll have a little bit of time for reflection and feedback on what you learned. And this is also a great opportunity for us in the department because our built environment evaluation guide was created back in 2018 after our first round of built environment grants concluded. And it really hasn't changed since then. And so this is a great opportunity to get some feedback from you all as participants who are a fresh set of eyes on this work and thinking about what are some things that you might recommend that we could add and change in our guide to update it and make sure that it's as relevant as possible for the work that we're doing in Tennessee. So I think, we're going to learn from you as well. So to provide a little bit of context for the guide that I'm going to walk through today, I want to tell you just a little bit about our Healthy Built Environments Grant Program. We have a program that is state funded here in Tennessee with the purpose of increasing access to publicly accessible health promoting spaces in communities across Tennessee. The idea for this is that we know communities know what they need. They know how to improve health and to promote health at the local level. So we want to provide funding to help support that. It's a competitive process. We only have 860,000 in state funding per year for this program, so it's not a lot of money. So we try to stretch that as far as we can. We do not require a match for our funding. We see that as an equity issue. A lot of small rural communities, especially, don't have funding for a match for a lot of construction and planning grant programs. And so we don't require a match, but we do try to stretch our 860,000 as far as we can. So we do limit our grants up to $80,000 for construction projects and up to $50,000 for planning projects. They can combine this funding with other funding sources. They can use our grants as a match for a larger grant. So for example, if you're getting funding from our Department of Environment and Conservation to build a big new park, if you need a local match, you could use our grant for that, or our grant might help support a portion of a larger project. And sometimes our grants fund an entire project in and of itself. So it just kind of depends on what the community's needs are. Most of our projects are in rural communities. That's because most of Tennessee is rural. We have 95 counties in Tennessee. 6 of those are considered to be urban or metro areas. They actually operate their own city health departments. And then we have physical health department buildings in the other 89 counties across the state. Urban and rural communities are eligible to apply for these grants. It can be a municipality, it can be a nonprofit. It just can't go to a for-profit organization. But a lot of local communities that apply are from rural areas. Those are the ones that tend to need the funding the most and can stretch that $80,000 or $50,000 the farthest. So most of the projects we fund are in rural areas. Evaluation, we decided from the outset of this program is going to be a required component of all our grant awards. And there are a couple of reasons for that. One is that we really think that evaluation is important for communities where maybe people don't fully understand the value of some of these projects to sort of building a culture of health, to creating healthy places as a primary prevention approach. And so we really encourage communities to be able to show the impact that these projects have had. And that's important for them because if we invest a little bit and they can show the value in that, that better sets them up to be able to get more local funding or to be able to apply for larger grants to continue to build off of that success. So we see it in a very practical way. And that's why, as an approach, you'll see in a little bit that we actually let the communities themselves propose and design the evaluation for their project based on their needs. The other thing that I think is really one of the underappreciated aspects of evaluation in general is that if you plan it from the outset, if from the very beginning of figuring out what your project is going to be, if you build evaluation in from the start before your project ever begins, it can be a really useful project planning tool. It really helps to focus everyone together to build consensus on what you're trying to achieve with that project. And it helps everybody be on board to try to get to that end goal, to try to meet the needs that have been identified by everyone by that project. And that can help to shape the project in really positive ways. So it's kind of this prospective, looking ahead, what we're trying to achieve, and how do we plan for that? How do we design our project, whether it's our planning process or whether it's our construction project? How do we design that in a way that we can maximize our ability to reach those end goals, to improve those health outcomes that we're trying to achieve? So we really wanted people to be doing that from the outset. And so when we have communities apply for this grant program, they have to submit a logic model and an evaluation plan to us up front. That's not so unusual for a grant application, but it is something that we see as really critical, and we really do want the communities to identify what elements in evaluation are going to be most beneficial to them. So you can see a map here of all of the projects that we've funded to date. The projects in green, the little green markers, are projects we've funded. We've funded 259 projects so far, at least one project in all 95 counties in Tennessee. We also have another program that's funded through some state diabetes grant funding called Project Diabetes that funds some built environment projects as well. They fund more money per project, but fewer projects. And you can actually see those indicated by the little orange markers. So these are all different projects that we fund through the Tennessee Department of Health. We've invested 7.26 million since 2017 in projects across the state. We actually just awarded 11 more projects, which represents another $860,000 investment. So actually, we're now up to a little bit over 8 million total. And we funded a huge variety of things. We really are very flexible and fortunate to be flexible because of our state funding. So we really allow a lot of flexibility as long as they're planning or constructing a project that is publicly accessible to anyone at no cost. And they can show how it's addressing a health issue or a health disparity in their community. It's fair game. So we funded a lot of different kinds of things. You can see a few examples of things we funded here, things like walking tracks at schools and parks. We've funded playgrounds. We've funded farmers market pavilions, all sorts of different types of sports facilities like skate parks, basketball courts, baseball fields. We funded parks and park improvements. So in some cases, we've actually funded the construction of a park itself, a neighborhood park. Sometimes we're coming in and we're making improvements and enhancements like lighting or seating or restrooms, other things that make that park more visitable, more accessible, and a better asset in the community. We've funded greenways, rails to trails projects, and other paved trail projects. We've funded school gardens and community gardens. And we've even funded some other things that are really interesting, like bike share programs, bike repair stations. We funded crosswalks, signage. We funded a bicycle pedestrian safety study on a really dangerous corridor here in Nashville that included some tactical urbanism projects. So all different sorts of project examples that I can share, but there's a lot of diversity. And so you can kind of see already just from the breadth of the things that we fund, that we kind of have a challenge from the outset of thinking about evaluation. I mean, there's some common metrics that we can look at if we're trying to think about the program as a whole. But what we decided was because it's so diverse in what we could be funding, we really want each project to have its own goals, its own evaluation metrics, and really have it to be tailored for each individual project. Here are some photos of things that we've funded through the program. So you can see we have an inclusive playground up in the top left. We've got a master plan down here in the bottom left. We have a pump track up in Northeast Tennessee in the center. Then we've got a greenway, our bike share program, and some outdoor exercise equipment at a neighborhood park. So just a few examples of some of the things that we've funded over the years. So our approach to evaluation is we do require it of all grant projects, as I mentioned. We do require all of our grantees to develop an evaluation plan and a logic model as part of their application. If you're awarded a grant, then you meet with project staff in our office and our evaluator on staff to discuss the evaluation plan prior to starting the project. And that's really a very hands-on, one-on-one opportunity for us to work with each of our grantees to talk through their evaluation plan, understand their thinking, and then we can make recommendations for how to improve it, help them to troubleshoot, think about potential partners. So we do start with what they create, but we also do try to help them to maximize the potential of the evaluation plan and also to review things that maybe are not appropriate. So there are always some challenges when you're talking about evaluating built environment projects in a public health context. It's not unusual for people to go online and find sort of small area health data, like at the census tract level, things that are that look exciting and are helpful for sort of making the case in a grant application, but they're not appropriate for looking at change as part of an evaluation. And I'll talk a little bit more about that when I get into some of the metrics. But sometimes communities are not super data savvy. They don't know exactly where the data come from, how they can be used or not used for evaluation purposes. So we can help them think through that piece as well. And then we do require them all to submit a final evaluation report. This can vary a lot. We have some basic questions that they have to answer about what they found in their evaluation, but they don't have to produce a huge report. Again, some of these are really small communities that we're funding. They may not have anyone. They may have a part-time mayor and one staff person, running things for that community or that county. And so we don't ask a whole lot for the evaluation report, just some basic findings to make sure that they're pulling all that together and that they've done the evaluation to fulfill that requirement. Some of our nonprofit partners who have evaluators on staff, they produce incredible reports, professionally designed, really beautifully done, that they can use to help apply for additional funding. So it really varies a whole lot from grantee to grantee what that final report looks like, but we don't require too much. What we offer to them to help them think through their evaluation are evaluation examples. So we have lots of examples now, having funded so many projects, to help people think through, what others have done and how that might inform their evaluation. We provide potential metrics and data collection methods through our built environment evaluation guide that I'll talk about. We have a whole library of survey and observation templates. So most of these are things that we've developed in-house over time. But we also have other resources that were developed externally. For example, something like SOPARC, which is kind of an observation tool that can be used for public spaces. So we have all sorts of things to meet our grantees' needs that are available to them. Links to external evaluation resources, and then technical assistance is needed. So if they get stuck and need some troubleshooting, we're available to help throughout the grant period. And the goal really for all of this is for grantees to design, conduct, and share findings of an evaluation that's specific to their project. We require a logic model of all our grantees. You can actually see an example here. This is a real one from one of our grant-funded projects. We stopped calling it a logic model. People found that super intimidating, and people got a little bit freaked out about it. It just sounds very researchy. If you're not a researcher or an evaluator, logic model, it terrifies people and gives them nightmares. So what we decided to do was change the name of it. So we now call it a flowchart. It is a logic model. If you've ever built one, you'll recognize this right away. But we tried to make it as easy as possible for people to see how you can fill this out, make it really simple for people who don't have any evaluation experience to see the value of a logic model and that structure and how it can be helpful for project planning and understanding what to measure to show the impact that it's had. We also created the Built Environment Evaluation Guide. So this is what I want to walk through a little bit before we do the interactive portion of our session today. So this guide was developed, as I mentioned, about 7 years ago. After we did a round of grants, we realized that our grantees needed a lot of help with evaluation. And so we wanted to give them a head start. We wanted to give them a guide that they could look through that was very simple, to the extent possible, written in plain language, something that they could look at as they're applying for this program to kind of get a sense of what we mean by evaluation and kind of walk them through all the different pieces that you have to think through when you create an evaluation plan. We have found this to be incredibly helpful. If you look at the evaluation plans that come from our grantees, it's very clear when they've used this guide, and they basically all use it because they know it's a requirement, and why not? And I'm really excited to see that our grantees have been able to use this and create an evaluation that's probably far better than they would have if we didn't provide a resource like this. So it is something that they're using. We found it to be really helpful. It's fairly detailed, but we also really try to emphasize that we don't want it to be prescriptive. So this is something that they can use. They can choose to do something totally different, but it's at least a starting point for them and kind of helps establish that baseline for what we expect and creating a baseline of a practical but relevant evaluation process. So there's a lot more detail in the guide than what I'm going to share with you during this presentation. I'm just going to highlight some of the key pieces that I think will be helpful for the interactive portion of this workshop, but the guide is available for free online. I'll put a link to it in the chat in a little bit so that everybody can access it because we're going to use it in the interactive portion. But it's something that's available to you whenever, and you can look through and you'll see some other parts of the guide that you may find helpful. But I'm going to cover the basics today. One of the things that I really try to emphasize a lot when working with grantees is that it's really important to start thinking about your goals for the project before you do any other work on your evaluation. And that kind of goes back to that project planning and consensus building piece of evaluation that I think is often underappreciated. You really don't want to start with, oh, these are some data that I could collect for my evaluation. Oh, these are the data that are available. You really want to start with what are you trying to achieve with that project? And everybody needs to be on the same page about that. These are the health outcomes that we're trying to impact. These are the behaviors that we want to change as a result of the project. This is how we want to improve access to certain things in our community. So really thinking about the goals, like what is it that we want to see change after we implement this project? And making sure that everybody is on the same page about those first. And that really helps to guide your whole evaluation planning process. That's what tells you what to measure, what you need to put into your project, and even to some degree, who to share your findings with. So this section is all about sharing some example project goals, things to help people think about what it means to develop goals or evaluation questions or an evaluation purpose. And this is something that you would do in any good evaluation, but we're just adapting that specifically for built environment projects. And the next piece, again, this strikes fear into the hearts of everyone. It's developing a logic model. So we really try to keep it basic and simple. We want this to be something where people see the value of creating a logic model. We don't really want to talk about it as a theory of change. We don't want to get into anything that's going to use terminology that's confusing to people. Probably in the next version of this guide, we might even call it a flow chart and just reference the term logic model for those people who are familiar with what a logic model is. But essentially, we want people to understand how you build it and how it's structured. And this is something I think that's really practical in all sorts of evaluation. A logic model can be really basic. It doesn't have to be complicated. It can be as complicated or as simple as you want. But we really try to highlight all the basic typical components of a logic model. So talking about the resources or the inputs, the things that we're putting into a project, things like staff time and funding and partners, activities. So what are you going to do with those resources or inputs? We're going to build a park. We're going to develop a policy. We're going to provide community education. The outputs are the things that are produced by those activities. An example is building a playground or developing a community plan or enacting a policy. So those are things that are created. Outcomes are the things that happen as a result of those outputs. So if you build a playground, if you create a community plan, what are some of the things that happen as a result of that? Are more people walking and biking? Is there increased access to green space? Decreased number of crashes involving pedestrians, things like that. And then the impact. This is really ultimately what you want to happen. And when you do that goal setting in the very beginning of the evaluation process, this is really what's determining what goes in the impact part of your logic model. So we're thinking about those long-term outcomes, things like decreasing obesity, improving pedestrian and cyclist safety, reductions in cardiovascular disease, improved mental health. Some of those health outcomes are what we're suggesting that people think of when they think of impact. For our grant projects, these are time-limited projects. They all have to wrap up within 2 years. And so chances are for a lot of these kinds of outcomes, you're not going to be able to measure or see changes in these during the grant period. You might choose to continue to try to evaluate and assess these things over time. But for our purposes, for what they're sending to us and the evaluation that they're doing for us, for the grant program to fulfill that requirement, we're not really looking for them to show decreased obesity. That's not very likely. That's probably something that's going to take years to see. If you're looking at population health data, those are things that are farther out than you're going to be able to evaluate for this grant project. But it's really important to know where you're trying to go. And the other thing I tell people say, well, how do you know what to do in order to get there? I think there's a lot of value here in thinking about what the research says. So making sure that you're doing things that are informed by evidence and research. If you know that research says it's more likely that people will be safer in a protected bike lane and that will reduce cyclist crashes, the research shows that. So we know that we want to build that protected bike lane, and then we can infer from that our impact is going to be safer streets. So you can think about the research as making that connection between the thing that you're producing and some of those shorter term outcomes and that longer term impact that you're looking for. So that's really important. So research really still is an integral part of this. The evidence is really an integral part of this. It's kind of what helps to fill in some of those gaps. But essentially a logic model, we propose it as what we plan to do and what happens as a result. And it is a linear process in the way that we're asking people to fill it out. So in order to get people started, we provide a list of some common types of metrics that we felt were relevant for the types of projects that we fund. So things like user counts and types. So like the number of people using a facility in a certain period of time, the types of the demographics of users using a facility. Can we show that that is changing as a result of our project or changing over time? policies adopted or changed, knowledge and attitudes about physical activity and health. And, is participating in activity on a greenway or on a playground, is that shaping people's knowledge and attitudes about how those things impact our health and how they're healthy or not? Partnerships that are developed. Partnerships are really critical to all of the projects that we do. I don't really know of any project we funded that didn't involve some type of partnership. And these projects can often be a catalyst for building a partnership that you can leverage and continue down the road for other projects as well. Site or facility descriptions. So things like the length of a greenway constructed. We constructed 2.3 miles of greenway, or we connected 6 spaces in a community with this new bikeway. So, looking at how we change the environment as a result of the project. Looking at behaviors, changes in behaviors. So are people more frequently physically active because we built something in the community? It promotes physical activity. And then access. So access to facilities is really important. We know from the research that if people are closer to something, for example, like a park, they're more likely to visit that park more often. So looking at the proximity to different facilities. Now we've built a neighborhood park. We've increased access for 300 new households who were not within half a mile of a park before we built it, as an example. A lot of these focus on changes in use and access. Those are kind of the two key things that we try to emphasize to our grantees. Can you show that a project has increased the use of something? People are using a park more because of the features we added. People are using the greenway system more because we expanded the greenway. And then access. Do more people have access to something than they did before? Are there more people within a half mile of a park or green space than there were before we built a project? How many people now have access to something that they didn't before in that community? We've built playgrounds in small rural communities that literally did not have a playground before they built it. So, sometimes it's a really dramatic change for a community with a relatively small amount of money. The health outcomes metric at the bottom really required a little bit of explanation. And I touched on this earlier, but we really try to make sure that people are not trying to measure some of these longer term chronic disease health outcomes with population health data. So a lot of times there are data like the CDC Places data, which are fantastic data for a lot of purposes. It's small area estimates that are modeled for communities using American Community Survey data and other data sources, where they're able to sort of estimate uh, different disease conditions at a very kind of micro geographic level. And those are really helpful for thinking about where you might want to direct resources, but those data cannot be used to evaluate changes in population health. That just because of the nature of the way those data sets are created, they're not sensitive enough to be able to pick up changes from, say, a built environment project in that community. So we try to dissuade people from trying to measure the long-term impact of things in a short period of time. We really try to help people see if we're looking ahead to those and we know the things that are going to make an impact down the road, we need to measure those things that we can measure in the short term for this to really be practical and appropriate. And there are, of course, things you can do in the short term too. If you're partnering with, for example, an academic partner who might be able to do something like, have devices that people can wear to measure physical activity and physical exertion. There are all sorts of technologies that you can use for evaluation as well. We don't really
environment, how to measure your impact.
Yeah, I think somebody came off mute by accident. If you don't mind muting, please, that would be great. Thank you so much. And so there are other things you can do, other technologies that you could use to incorporate for measuring health, but we don't recommend that typically for our grantees because usually they don't have the resources to do that, and we don't want them to use a significant amount of resources from a small grant to be able to do that. But those are options as well that we can talk through people if they're interested. We also propose some data collection methods. So there are lots of different ways you can collect data. Behavioral observations are a fairly time-intensive one, but you get a lot of data from doing that. There's a lot you can observe if you're there in person, watching how people are using a space over time. Think about William White and Social Life of Small Urban Spaces and the amount of information that he was able to gather, if you're familiar with that. Incredible documentary if you've never seen it, but just going out and watching what people are doing and where they're doing it and for how long can be incredibly rich data, but it is very time intensive. Built environment assessments, so going out and being able to sort of evaluate the components of an environment and how that's changed as a result of the project. Surveys are probably what our grantees do the most because it's pretty intuitive. People understand surveys and how to use survey data. It's really easy to put a QR code up or go out and hand out surveys at a project or have people on social media fill out surveys. Lots of ways to gather survey data. So this is something that people use a lot, and we have a lot of templates that help people think through this. And a lot of times they're assessing, how often people use a space, where they're coming from to use the space. Asking people to self-report on, do they come to this playground or are they more physically active more often than they were before it was built for some of our projects. So again, not perfect. A lot of times with these types of projects, it's hard to get pre and post data for certain things. That's just the reality of doing work with evaluating public spaces in a real world context. It's not a laboratory. So we try to do the best that we can and just acknowledge those limitations. And then existing data and records. So lots of existing data out there that are helpful. US Census data, GIS data can be used to do that analysis of access and how it's changed. All sorts of data sources, secondary data sources that are already out there that you could use and pull into your project. And we see that a lot with our grantees as well. There are also, again, lots of new technologies that are emerging now for collecting data. We do have grantees who use things like trail counters, and we can fund that. That's an eligible expense through our grants. And that's something that'll last well beyond the grant period. Those trail counters will be there for years and they can keep collecting data on use. There are all kinds of interesting like image recognition tools, AI. There are things that people now are using, cell phone records to see who's visiting a space. You can do geofencing and purchase cell phone records that are de-identified. Again, we don't really recommend a lot of these things to our grantees because they often don't have the resources to do them. But there are a lot of great tools out there like that now that people can use to evaluate some of these projects in public spaces, just depending on the budget and your capacity. So this is an example of one page. We have a few pages of these metrics and data collection methods for different project types in the evaluation guide. Again, we don't want to be overly prescriptive, but we do want to give people a pretty specific idea of things that they could do. So here's some examples of some things that we fund pretty often, like trails and walking tracks, playgrounds. We give some sample metrics and then some sample data collection methods for collecting data for those metrics. So we do try to provide a lot of options. It's almost like a menu, but they don't have to pick from the menu. They can go custom and they can do other things. But at least if they don't really have a good sense of what it means to develop metrics and how to collect data on those, this gives them a really, really good start. So an example of how that kind of all comes together. So there's an example in the guide of a greenway evaluation. So you can see here for outputs and outcomes, if you wanted to plug these into your logic model, you might develop some outputs like number of partnerships developed, community meetings held, building a greenway, some education and marketing materials. And then associated with those in green underneath, you can see some metrics that you could use to evaluate those. And then in blue below that, some data collection methods for each of those metrics. So you can kind of map it all out. This is pretty intense. If you're building a greenway, you're probably not going to do all of this. This is a pretty overly inclusive example, but just to give people a sense of how you would sort of build that out. If you've got a logic model, this is how you would connect some metrics and some data collection methods with those outputs and outcomes. Just a few really quick examples. These are actual projects that we funded. So we funded lots of walking tracks and playgrounds. This one is in Unicoi County, Tennessee. They did a survey and they were able to determine that 50% of users used the playground and walking track a few times a week, 13% used them every day, 84% were more physically active through self-report in general because they visit the playground and walking path. About half of the adults bring children with them to the playground and walking path. So you have a lot of adults that are walking while kids are playing. And then 80%, 82% of parents felt their children were more physically active because of the improvements, because of the additional playground equipment. So just an example of something really practical. We can see that things seem to be changing, improving. So this is something that we see a lot with our grantees doing surveys like this. I talked a lot about changing access, improving access to things in communities. So we actually had a walking track. You can see an aerial view of it here that we constructed in Pulaski, Tennessee as part of an agriculture park. So we were able to we actually worked with the grantee to help them do a GIS analysis of the number of households within 1 and 3 miles of walking places in the community. So we gathered data with the community on places that people could walk in Pulaski. And then we mapped all of those. We geocoded and mapped them. And then we were able to see by building the walking track how many households now were within 1 to 3 miles of a walking place now that we built this new facility. And so we were able to show that change and how access had improved. So an example of sort of being able to sort of measure access using some tools like GIS and community data. Our Dickerson Pike Pedestrian Safety Project that we funded in Nashville, which included a youth design team, tactical urbanism project, which you can see pictured here, was really exciting. They were able to measure changes in pedestrian safety and traffic speeds as a result of the tactical urbanism project that they installed. So you can see they're standing on a kind of a bulb out here that they painted and a temporary crosswalk. One of the things that they also chose to include in their evaluation was the partnerships. They did a really great job with community engagement, engaging the local DOT and the state DOT. And in fact, they did such a great job with the community engagement that the State Department of Transportation, who was part of that process, is now investing roughly $50 million in a corridor redesign for this section of roadway that was part of the project. So their $80,000 grant has now leveraged around $50 million in state funding for a roadway redesign to make it a complete street and more bike ped friendly. So obviously they wanted to do strong community engagement. They wanted to make the case for permanent improvements. And so as part of their evaluation, they obviously wanted to highlight being able to catalyze that larger investment. And then we also fund planning projects. A lot of small communities need to fund plans in order to apply for larger infrastructure funding. So things like parks and greenways and outdoor rec and trail master plans, downtown master plans. If they don't have a plan in place with preliminary design and engineering work done, they can't really apply for some of those larger grants that might be, $250,000, $500,000 or more. And so we provide the opportunity for them to produce that plan with one of our grants with no match, and then they can take that plan and they can apply for larger funding. So an example in Cumberland Gap, Tennessee, they created a master plan and trailhead development plan, and they were able to use that plan to apply for and were awarded a $250,000 grant from our Department of Environment and Conservation to build a new park and civic space and nearly $600,000 in water infrastructure improvements. Both of those were recommendations in the plan. So in this case, the evaluation was not just about the planning process, but they also were able to show how this plan was able to produce additional funding and real physical change in that community. All right, so we are going to move to the interactive portion of our workshop today. So hopefully everybody is still awake. We're going to break out into 4 different groups to design 4 different evaluation plans for 4 different projects. So what you'll do, 4 breakout groups, room 1, 2, 3, and 4. I believe everyone will be randomly assigned to one of these 4 rooms. So room 1 is going to design an evaluation plan for a Rails to Trails project. If you're not familiar with what that is, it's an old railway that's going to be paved and turned into essentially a greenway or a paved walking and biking trail in a rural community. We've funded several of these projects in Tennessee. Room 2 is going to focus on a playground and walking track at a neighborhood park. Room 3 is going to focus on evaluation of a Parks and Rec master plan for a rural community. And room 4 is going to focus on a tactical urbanism bike ped safety installation on a major corridor. So these are all examples of things that we have funded here in Tennessee through this program. The tactical urbanism, if you're not familiar with that term, is essentially a temporary project where you make temporary changes to a space to show what permanent improvements could produce. So it's a way to say, hey, if we make these changes permanent, this is the impact that we're going to see. So it gives you a chance to try something out and to demonstrate. It's essentially a demonstration project to show what a permanent change could do. So those are the 4 projects. So what each of you will do in your breakout groups is first identify the intended health outcomes of your project. So what is it that you're trying to achieve? What health outcomes or health-related outcomes are you trying to impact in the long term with your project? Once you do that, you'll develop a logic model to show how the project will lead to those outcomes. Again, this is going to be the flow chart. So we're going to share that template that I showed you earlier that we give to all of our grantees, the project flow chart. That's what you'll fill out, essentially a logic model. So it's going to include all those components I talked about. It's going to include your inputs, the activities you do with those inputs, your outputs, and your outcomes. And then once you do that, choose some metrics that align with your logic model and identify a data collection method for each of those. You don't have to go crazy. We don't have a ton of time. We have maybe 20 minutes to do this in our breakout groups. So you don't have to do every single thing that you think of, but kind of get as far into it as you can. It's really fun to kind of think about what you're trying to achieve and ways that you can measure that and collect data. So get as far as you can into it. These could be qualitative or quantitative metrics. You can assess things through numbers. You can assess things through interviews. It can be either one. And then develop a dissemination plan for your evaluation findings. So what we really try to focus on is if you do this evaluation, how can you practically use it? Who should see this in order to build off the evaluation, to continue and to improve and grow this project over time, to develop similar projects in your community? How do you continue to build off of this? So who would you need to share the evaluation findings with? And why is it important to share them with those specific people or organizations? So just kind of thinking through the follow-up piece. What are you going to do with this? Why is this practical for you and your community?
Everyone should be back in now.
All right. Hey, everyone. Welcome back. Wow. So we've learned so much while you were in your breakout room, all the things that you all could not see in your breakout rooms, including the chat. So we sincerely apologize that you didn't have access to the things that we were putting in the chat and trying to broadcast to you all. That's really a bummer and our fault, and sincerely apologize for that. But I hope that at least after the presentation, you all were able to talk through what an evaluation plan might look like for some of these different projects. So we may not have 5 minutes worth of report out for each group, but I am really curious to know what you all talked about. So feel free to report on what you see here on the screen, or just talk about the discussion that you had. What did you learn from the discussion in your small breakout groups? Maybe someone from room 1, would you like to share what you learned and any progress you made on developing an evaluation plan?
Sharon was our note taker, so
Okay.
she guided
Oh,
us through the
okay.
process.
I was just gonna say, I don't know. I was in that group, but I was having a difficulty unmuting there for a second. But I didn't know if you wanted me to talk about it, Raquel, or if you wanted to talk about it since.
No, I think
Okay.
you did a fabulous job walking us through the different steps and providing us with your expertise. We were
Okay,
more
thank you.
learning than anything else.
Oh, well, thanks. Yeah, I could real fast talk about what we did. We said we kind of went through the logic model, and some of the resources we anticipated that we would have had in this small community might include a Parks and Rec committee or an equivalent that was probably managing a subcontract with a construction firm. So that construction firm is another resource. We're going to assume they have some grant money as a resource, some dedicated volunteer city council member time for community engagement. And also we, in our pretend scenario, we listed a partnership with TVA as a resource because we were pretending TVA owned the land. So those were some resources. Some activities that were going to happen for that was obviously like, actually building it and doing some community engagement to get some community input on the design of the trail and things that they wanted to see on the trail. Some activities that are things we wanted to produce through that would be a memorandum of agreement with TVA to allow the public to use the land once it was constructed. We wanted also some community input and a result of that. And then also, of course, the actual trail construction. And then some long-term impacts we would want it to have is increase in health in the community. So a decrease in obesity and diabetes, improvements in mental health, increased sense of community. So we took all this to make the little evaluation plan, and kind of as discussed earlier, you can't really, it's difficult to measure a decrease in obesity and diabetes and things like that in a short period of time. And it's unlikely to happen in this 2-year scope, but we did pick some desired outcomes we would want to see is an increase in physical activity, an increase in social cohesion, an increase in time spent outside, increased mental health, and also an increase in the number of people that are actually using the space. So that's some of our desired outcomes, some metrics that we could use to measure whether or not we've met those desired outcomes included how many people are there and how long, how many self-reported questions of how people feel through a survey after using the park, like a question such as, I feel an increased sense of mental well-being after using this space. You could rate that on a Likert scale. You could also ask people similar questions regarding social cohesion, ask them, if they were able to make any connections, friends, whatever in their time there. And also if they feel a better sense of community after their use of the space. We could also ask them how much time they had spent in the area before and after the construction to see if there might be an increase in time being spent outdoors or time doing a physical activity. And we could ask them questions about what their use of the space was, how long they were walking or running or whatever it was that they were doing, and how much they did it before and after the construction to see if we have had an increase in physical activity. So those are more the metrics and the methods that we talked about. Surveys, like you said, they're probably the most realistic in this community, but we also touched on potentially using ArcGIS data. If we didn't have so much observation would be nice, a pre and post on how many people are using it and for what, but that's not always possible. So we could also do some ArcGIS analysis of maybe how many people live within a half-mile radius of this new construction to see how many people now have access to an opportunity to be more physically active.
And I, as the person who was learning, the one thing that I thought, I don't know if your guide already has it or not, but if it does, because I have to explore it, but if it does not, one thing that might be useful would be to have existing standardized scales for these different measures that we were talking about. Some of them exist. Some others may not be exactly appropriate for the use in question, but could be adapted. I worked a while back on a connection with nature type of scale. And so there are, some of them who are which are standardized, and that's helpful then for comparison, because if everyone is using the same question, then you can actually do a full scale evaluation of the different projects. So that was something that as a learner, I was thinking about might be useful for your guide or for your overall program evaluation.
Yeah, that's wonderful. Thank you. Yeah, thanks, Raquel. That's great advice. And it actually is one of the things that I'm hoping to get out of this session for us is some of those kinds of recommendations to help improve this process and improve our guide for future grantees. So I appreciate that. Thank you. And that's a great idea. And thanks, Shannon, for the report out. Sounds like you guys had a great conversation. So thanks. What's group 2? What did you all talk about?
Good afternoon, everyone. I'm reporting out for Group 2. So a lot of similarities for stakeholders, for getting things together, identifying resources, what funds we were going to need to build out this playground. But one thing unique that came out, because we assumed that our playground was more in a suburban or urban area because it does not say. And a conversation that really started to evolve and get very rich was around connecting and bringing the natural environment into the built environment. So in planning this playground and walking trail, but especially the playground, we're really focusing on the playground, making sure that some of our funding brought in trees for shade. Slides can get really hot. And thinking about what those trees and other landscape products are to help clear the air, clean the air, looking at particulate matter, things along that line. So I would say that was our biggest aha and contribution beyond Team 1. Is thinking about also bringing in the natural environment to the built environment.
Yeah, that's wonderful. I love that. And it's so interesting too that you bring that up because this current cycle of grants that we just awarded, this is the first time that we have included language in our request for applications about environmental resilience and encouraging our grantees to think about shade structures, not removing existing tree canopy, thinking about ways to ensure they're planting native species, things like that, which we've never included language before like that. Sometimes our grantees did it, most of the time they didn't. And we really saw, by putting that in the request for applications, we really saw that reflected in the proposals. And that's really thanks to Shannon, who's here on this call. She's really the one that led that and added that language and has encouraged that. So that's made a huge difference. And yeah, and I think thinking about health in terms of safety and being able to provide that shade and thinking like more holistically about the environment and how this project connects to and protects the environment around it. I think having those goals helps you to know what to assess and how to determine whether you're really doing that. So that's wonderful. Thank you.
One of the other things we talked about in that group, and was about we talked a lot about the stakeholders and doing like an assessment of who could be involved in the planning effort around whether it's the group that's applying for the grant together or the planning or pulling together a group of partners to help plan the design of the site was also kind of a general outcome around in addition to promoting physical activity and ultimately helping to address obesity and whatnot, but also that the closer partnerships would be in itself an outcome. Because then, if there is a health coalition operating in that community or not, it can, all the more partners at the table can help to do additional projects like this or other efforts, other health promotion efforts.
Which
Yeah,
also, if I could just build off of the communication plan, that was the other task, creating
yes.
this shared website or some mechanism for community sharing of information and experiences. Not only does it allow for community groups to form and report on activities like starting walking clubs, but it also gives you a chance to be able to share information on what comes out of the program.
Yeah, that's a great idea. I mean, community engagement is a critical part of this. I love the idea of having like an online space, a forum for people to share information. Yeah, I mean, I think process is outcome. I love that. I think, making sure that you're including the stakeholders, that you're including the community that's going to directly benefit and be impacted by the project to make sure the project is going to meet their needs, that there are no unintended adverse consequences. And also, it's a great opportunity just to educate people about the benefits that these projects can have in their communities and how it does improve health, how physical activity and mental health can be improved, how this project can be sort of leveraged to continue to invest in communities. So yeah, I mean, I think being able to assess that and ensure you have the right people at the table in the process is really important. So I love that. I think we have our group 3 didn't have enough people in it, so we pushed everybody out to other groups. But group 4, did you have anything you wanted to share that might be a little bit different than what we've heard already?
Hi. So we had the tactical urbanism bike ped safety installation, and we decided that what that meant for us was creating some kind of physical barrier between a bike ped lane and the corridor and making it community art at the same time. And so, obviously, like big picture, we want to see less or zero traffic related injuries and deaths. And then more people using it, more people getting out, using active transportation and getting more physical activity. Um, I'm going to skip through the inputs. I think you all can just like guess what would go into that. But I think, a metric is obviously just how many traffic related injuries and deaths are we seeing? Could we look at speeding ticket and traffic violations data before and after the installation? And then we can send out and we do like a before and after audit, actual sitting out there, counting people, counting cars, counting bikes, or seeing if we can use some kind of like, we don't know what it's called. The thing that construction workers use to like count cars on a road. And then to kind of get at the like how do people feel about this space? Does it give them a better sense of community or perception or reality of safety? All of those questions can be asked in a survey. And then we figure, if this is kind of a temporary thing but we want it to be permanent, we're going to have to ask for more funding. So it's going to need to go to the city council or the county council to ask for funding for maintenance for the painting and any like damage that might occur to the structure. And whatever entity is responsible, if it's not the city for the road maintenance, so if it's like a Department of Transportation or whoever that is. Yeah, I'm going to stop there.
Yeah, no, that's fantastic. Yeah, you guys did a great job. And I realize as everybody's talking, you all did a great job of kind of coming up with a scenario and a story for your community where your project would happen. I know that um, I try not to give people like a long description of something specific for this because it just takes a while to kind of read through and wrap your head around and it sucks away a lot of time. So I like that people just jumped in and kind of came up with a story to work off of. And yeah, and the specifics and the context for these projects makes all the difference. Who's the community? Where's the project going to be? Who's funding it? The political context, all of that is so important. Um, so lots of things to consider. Well, you guys did a great job with very limited information that we were able to share with you in your breakout groups. So nice work, and sorry about that, but you all did just fine. So you've already touched on a lot of these things. I just wanted to take a moment to reflect. I think you all talked a lot about things you learned from your conversations. You've already shared a couple of really great suggestions, but just wanted to open up for our last couple of minutes. Was there anything that surprised you that was especially challenging during these conversations? And is there anything that you feel would be important to include in the guide that if you've had a chance to see the guide, did you notice that there was something missing that you would like to see in there, or just in general, things you think would be useful for you?
I'll say.
Go for it.
I put this in the comments, but if the guide doesn't have the link to your counter technology, if you would, because we were all intrigued to see if it's affordable and easily usable, because that sounds like a wonderful resource.
Yeah, we can definitely do that. Yeah, the counters, and we as a government agency, it's tricky for us. We can't promote like specific brands of counters, but we do recommend that people get them because they are relatively inexpensive or can be relatively inexpensive, and we do allow people to use grant funds to purchase those. But yeah, but we don't mention anywhere in the guide about counters because I think when we wrote the guide, they were more expensive, and I think now they're a little bit more commonly utilized. So we need to add that. Any other recommendations or just challenges, things unexpected that came up in your conversations that made it hard to think through some pieces of this? All right. Well, thank you all
Just
so
going to
much.
say, John,
Sorry.
considering that this was a quick turnaround in your presentation, and bringing people together who did not know one another, no brag, just fact, I think we all did a fabulous job. And it was because of your presentation. And I'm so looking forward to the slides and the recording. Thank you
Well,
very
thank you.
much, everyone.
Yeah, no, thank you, Robin. I really appreciate that. I appreciate that so much. Yeah, you guys did an amazing job with very limited information in a short period of time. I'm really excited that I got to share this information with you. I will share the slides out as well as links to the guide. Yeah, and hopefully this is something that will be useful to you in your work. And feel free to reach out anytime. I'm happy to meet individually or share other resources. Shannon, again, is also a part of SOPHIA and can certainly be a great contact for some of this as well. So just thank you all for being here and for staying awake at the sleepiest part of the day.
Thank you, John, so much. And thank you to those of you who joined and participated actively. We really appreciate you coming. I have put the link and the information for our upcoming SOPHIA webinar with Michael Chang on September 10th from 11 to 12 Eastern. So I hope that you will sign up and join us again. And if you had a great time today, please join SOPHIA. Thanks so much.
Bye-bye.
Thank you. Bye.